This is Rural Health Leadership Radio.
Hi, everybody. I am your host, Dr. Bill Oxier. Welcome to this special episode of Rural Health Leadership Radio. I'm excited to introduce today's guest. Today's guest is Melinda Giese, Vice President of Enterprise Client Solutions with CHG Healthcare. Welcome to Rural Health Leadership Radio, Melinda.
Thank you. It's so great to be here.
So tell us about yourself. Who is Melinda Giese? What's your story?
Melinda Giese. Well, there's a long story there, but in a short version of that, I'm a healthcare executive that's for 25 years working in the healthcare space in a variety of different capacities. Spent most of my career on the payer side, working for companies like Aetna and Coventry Healthcare, and then more recently in serving the physician community through CHG and the locums and other staffing brands that we have.
Okay, so I'm sure that Melinda had many choices on how to choose her career path. Why did you choose a career path in healthcare?
I mean, the answer you probably get from a lot of people is to help other people and to be part of a solution. Healthcare is very complicated, it's complex, and I love all the details that go into it, but people need advocates in healthcare. Rural hospitals need advocates, patients need advocates, and that's what I enjoy the most.
Yeah, wonderful. Thank you. It's always good to hear someone that wants to help people. So thank you for that. Now, that explains why you chose healthcare. Why are you focused on rural health?
Oh, gee, I mean, my family's from rural area.
Okay.
My husband's family are from rural areas, and they just don't have access to rural healthcare the same way healthcare the same way the rest of us do.
Right.
We're all really impacted by this, actually. We all have some sort of a connection to rural communities, and I think it's really important for all Americans to have access to quality healthcare, regardless of where they live.
Yeah. So did you grow up in a rural community yourself then?
My family did, my husband did. There's a little town northeast of Salt Lake City, Vernal, Utah.
Okay.
Small Native American community.
Okay.
And very underserved. And you can see that there's significant need for greater access to care.
Yeah, absolutely. Okay. Well, thank you. So as you know, Melinda, the name of this program is Rural Health Leadership Radio, and I emphasize the word leadership. What's your definition of leadership?
I think leadership has taken on a lot of different forms over my career. But I would say through all of that, at the end of the day, leaders exist to serve the people that work for them, and not the other way around. And so I think my job is to help develop people professionally and help them meet their career goals, and for us all to, at the end of the day, feel like we're contributing.
Excellent. I like the serve part in there. So thank you for sharing that definition with us. Can you give us an overview of CHG Healthcare and the community that you serve?
Absolutely. CHG Healthcare is actually one of the largest locum firms in the country. We staff physicians, advanced practice providers, and nurses to a significant extent with most major health systems and a very large number of rural systems as well, independent hospitals. And so we have a pretty diverse customer base, both from the type of service we provide as well as the setting of care in which the patient's being seen. We started our organization quite some time ago, actually out of a grant for a couple of students at the University of Utah. They were looking actually to determine how they could provide some relief to physicians in rural communities.
Interesting.
And really that's how our company began as a result of that grant and the research that they did in providing some relief to actually Native American physicians who were kind of the only option for people in those communities. And it was so popular and such a great idea that we built the whole business around it.
Yeah, very interesting story of origin. So thank you for that. The COVID-19 pandemic has really turned everybody's world upside down. What impact has it had on you and your organization?
Oh yeah, I mean, it has been significant all the way around. And just talking with all of our customers around the impact to the hospital systems, and independent hospitals around the country. It's been devastating. We are seeing a big ramp up and a pickup in business. And we're hopeful that by, toward the end of this year, we'll see significant beds filled and patient census starting to grow and climb as we talk to customers. For CHG specifically, we've definitely seen a decline in certain specialties,
Sure.
but in others we've seen a real increase.
Oh.
Pulmonology, emergency care, and a number of other specialties, we've seen significant increases, and in certain areas of the country, we've also seen some significant increases.
Sure.
In other areas and at large, we've seen significant declines with the elective surgeries and other elective services being put on hold. And even as our customers are coming back online, there's some fear around patients coming in to be seen, and so.
Right.
Census isn't growing equally across the board. We deployed our 3,000 employees to work from home in about a couple of days. We were able to do that. Wow. And most of us are still working remotely.
Gotcha. Yeah, man, it's certainly had an impact, and that's interesting how it's affected the demand for providers in certain areas and all that as well. You mentioned, in the origin story of CHG Healthcare was created to serve rural health in a small rural area of Utah. Why is rural health so important to CHG?
Rural health represents a significant portion of the business that we do.
Okay.
Over half of our business lies in a rural market, rural community. Rural communities have a difficult time staffing and maintaining the right ratios of providers to patients, given fluctuations that might happen. And so we're a really important part of their strategy to make sure they can continue to serve the community when they have a spike in their census, or if they have even a single physician leave their organization, that can really be devastating to their financials. And so we serve as a stopgap for those facilities and give them the relief they need, whether it's for a very short period of time or even an extended period of time.
Okay. Well, if a rural health leader they realize, okay, I need help. I need to find a company or an organization like CHG Healthcare to help me out. When they're looking for an outside source like your company, what are the top 3 things that they need to look for or consider in that decision-making process?
Yeah, I think the 3 most important things are that we can deliver the doctor that they need that's a good fit for them.
Okay.
That it's a quality doctor, that they can count on that doctor to provide the level of quality they would provide with any of their employed physicians, and that a patient is seen in a quality way, and that they have a partner, somebody they can reach out to and say, hey, in a few weeks, I'm going to need this type of physician service or coverage. I'm dealing with a financial challenge. What creative ways can we think about, addressing those challenges? I think, being able to allow them to continue their revenue stream means getting them a quality doctor in a timely manner and making sure that it's a really good fit.
Okay. Yeah. That sounds like 3 important things. All right. That's for sure. One of the things we like to do here on Rural Health Leadership Radio is share best practices, right? We can be the tide that rises all ships by sharing best practices. What are some of the best practices that you've seen some of the top rural health leaders that you've worked with around staffing?
Yeah, it's a really good question. Oftentimes, we don't love this, but it's true. Oftentimes, locums is seen as a necessary evil, or temporary physician staffing can be, not necessarily the ideal answer. The ideal answer is a permanent provider, and we recognize that.
Sure.
But having a good partner and being prepared, as you go from rural facility to rural facility, the better prepared that facility is for that vacancy to happen, whether that's a temporary, vacation type of coverage, or, you lost your neurosurgeon and you need somebody immediately to come in and make sure that you continue your revenue stream and patient continuity is not sacrificed. Having a partner who's ready to help you and that you're prepared
Mhm.
And we think of locum staffing as a strategy as opposed to the necessary evil. And when we really partner with the customer for them to start thinking about it that way, then we can be lined up and ready to go when they need us.
Great. Some good best practices. Thank you for sharing that. Now, I know that you talk about partnering, and I know that CHG Healthcare is a partner with NRHA. And I know a lot of the hospitals and healthcare systems within NRHA have taken advantage of your organization's services. Can you tell us about one of your clients or customers, however you refer to them? Can you tell us a success story where you really helped them out, made an impact?
Absolutely. The locums industry is an interesting one, and a lot of the work that happens takes place via a lot of phone calls.
Okay.
There's a lot of outbound calling on our behalf, and a lot of inbound calls come into us when a need is identified.
Okay.
We've worked with a number of customers to really centralize and streamline the process by which we work together so that we can eliminate some of that back and forth and really be on the ready for when that need arises, rather than having that exchange of the constant phone calls. And we've been able to do that successfully with a number of different systems. I think the main point here is about understanding the need of the rural hospital and
Hmm.
then developing a process by which we work together that works for both parties. And we always think of it as really a three-party equation. Our customer, the hospital, ourselves, of course, and the provider, who's the third
Sure.
equation, right?
Yeah.
Making sure there's a setup that works for everyone involved and
Right.
that it's streamlined and efficient, because we know this isn't the core of our customers' business. They're focused on serving patients, and we want to be part of their ability to do that as opposed to a hindrance.
Okay. Good. Thank you. So, Melinda, what scares you the most about the future of rural health in America?
Well, with COVID kind of accelerating concerns around that, just hospital closures in general.
Yes.
It's so sad to see so many hospitals financially struggling. And, having had my husband come from a rural community, I can't imagine what would happen if the one hospital in his town closed. There's a lot of people who depend on that hospital. And, CHG's really focused on helping and want to be part of the solution, want to help these struggling hospitals build their patient volumes. And we think having a locum strategy is one of the ways you can do that. Again, if any one critical physician drops out of the equation for whatever reason, that means your revenues also fall with that. And so having locums, a locum strategy for quick replacement of that physician to allow you to keep doing business and keep your revenues flowing can be the difference between open or closed hospitals in a lot of these scenarios. So we feel like we have an important role to serve here.
Yeah, sounds like it. Yeah, and that is scary too. So, well, let me flip that question around for you to a more positive way of looking at it. What excites you the most about the future of rural health?
Well, I am excited about the future of rural health because of the way rural health leaders adapt to change.
Yes.
They're very nimble. It's so impressive to watch how they've handled the COVID pandemic. I also work with a lot of large hospital systems, and I've been just as impressed with the way small hospitals have handled, and sometimes more impressed with the way they've really been able to tackle some of these challenges, collaborating with other hospital leaders, utilizing hospital association leadership to come together and rally, and utilizing organizations like the NRHA to lean on to get best practice and good ideas. I'm super encouraged by the great ideas coming out of rural health.
That's great. Yeah, lots of great innovations, that's for sure. So we've covered quite a few topics here today, Melinda. If our listeners only take one thing away from our conversation today, what should that be?
Yeah, I think that CHG desires to be a trusted partner to the rural hospital, and developing a strategy as opposed to thinking about having temporary staffing needs filled only when in an emergency, but really having a strategy to make sure that you never have gaps in coverage so you can continue to generate revenues. There's no better way to do it than through a temporary partner, because there are ebbs and flows in the business. And I think, being able to serve that community and keep the patient continuity and care together is what will allow rural hospitals to stay open and allow them to continue to be profitable. I know there's many, many other challenges, and I don't mean to oversimplify that, but I do think from our perspective and how we see it, embracing a strategic approach to how you're going to keep things continuous and keep your revenues flowing is an important component of that.
Melinda Giese, Vice President of Enterprise Client Solutions with CHG Healthcare. Thank you so much for being here today and sharing your knowledge and expertise. Really appreciate it.
Thank you. It was a pleasure.
Yes, and my pleasure as well. If you would like to connect with Melinda, if you're interested in learning more about what she was talking about or about her company, you can find her contact information in the notes below this video. You can also reach out to me if you can't get a hold of her, and I'll put the two of you in contact with each other. You can also learn more about CHG Healthcare by visiting their website. It's a pretty simple website. It's chghealthcare.com. And if you'd like to learn more about this podcast, Rural Health Leadership Radio, guess what? We have a website too. It's rhlradio.com. Or if you have a smartphone, just look at your podcast app, click on that, hit search for Rural Health Leadership Radio, and subscribe. If you enjoyed this special episode of Rural Health Leadership Radio today, or you know someone else who might benefit from Melinda's words of wisdom, please share it. We're here to serve you, and that will do that if you can share this information. Until next time, let's keep working to improve rural health, one conversation at a time.